my concern, and again, I think it would be great if all experts in the field could get together. But the concern, and this is the concern of many people, is that the NIH in particular has perhaps accusations could be leveled at the NIH of favoring molecular genetic testing or favoring research in molecular genetics. It's utterly understandable that it is so, but it's necessarily, there's always, a cake has a limited number of slices. So the funding is always never going to be enough. And the argument that could and perhaps should be made is, should there be more funding at looking at non-genetic causes of Parkinson's disease? The concern is that the first mutation in Parkinson's disease in synuclein was described, if I remember correctly, in 1995. So we're now 28 years later. There have been quite a few genes described since then, as we've discussed, LOG2, GBA, and many, particularly in GBA, many variants. But how significant are these? So we all know if you do a GWAS study, you'll get multiple hits. People have said, somewhat tongue-in-cheek, if you do enough GWAS studies, you'll identify the whole genome. So the problem with those hits is they have relatively weak effects, probably no stronger than the average environmental cause. And don't get me wrong, the argument for a clear-cut environmental cause in Parkinson's disease is probably not strong. And there's been very good research with respect to that. But my point that I'm trying to make is simply that perhaps there's been too much emphasis on molecular genetics, and of course that's understandable, but perhaps we need to just sit back a little bit and acknowledge there's no treatment. Genetic treatments are very difficult. This may all change, but necessarily, if you're making predictions, like any prediction, you can be wrong. So predicting that a series of genetic treatments is going to be the big fix for Parkinson's disease is unfortunately guesswork. It may be very educated guesswork, but it is, as with any treatment, is then subject to the scrutiny of a randomized controlled trial. So fundamentally, I think it's time for us to say 28 years have passed. How far are we with establishing a genetic cause for Parkinson's disease? And should we be reassessing how important research resources are distributed?